Good morning and thank you for coming. I'm Marketa Garner Walters, the Secretary of the Department of Children and Family Services. We ask you to come today because we want to give you more information about what's going on in the agency right now, and we're very busy doing the work that we've been called to do, and I want to give you the space to be able to ask us some questions. As you know, we have an ongoing investigation into the tragic death of 1-year-old Jure Paul. We put out information to you on Saturday that gave you as much information about the case as we have at this point that we can give you. It is still an ongoing investigation. Law enforcement and the coroner's office are still working on this case, so we're not going to talk much more about that. What we know is that we've lost a precious child, and we're deeply grieved by that death, like we are the death of any child at any time. We hope that the information we gave you on Saturday is answering your questions. Today, I want to talk a little bit about what's going on in Baton Rouge, in particular in some of the ways that we're addressing that question. I will be followed by Dr. Rhenda Hodnett, who is the Assistant Secretary for Child Welfare, and then her Senior Deputy, Evelyn Jenkins, will follow her, and then we'll take questions after that. I hope I can address some of your questions before that. One of the things you had questions about was the emergency teams. You heard about emergency teams, so I want to explain that. At DCFS, we're a crisis agency. We respond to emergencies all the time. You're well aware of our role in emergency preparedness. During those kind of disasters, we mobilize staff from all over the department to come in and do specific duties for a specific time frame so they leave their regular work and they move into a new body of work. So the men and women that work here are totally committed to jumping in anytime, any place, anywhere they're needed. And so that's what this emergency team that you heard about is doing. Back in August, we composed a strike team of investigators, experienced child abuse investigators from around the state to come in and help in Baton Rouge because we have a staffing crisis there. We've talked to you about that multiple times. There's a staffing crisis in Baton Rouge. So we called in people from around the state to come in and help with the child abuse investigations on the ground in Baton Rouge. There were 17 of them. Most of them have been here about 3 months. Some of them are staggering a little bit. It was time for them to leave and go back to their parishes. And so as we were constantly assessing what do we do and how do we replace them, because Baton Rouge is still not staffed up to the level it needs to be, we still need more people, we called in what we're calling the rapid response team. And that's what you may have heard or seen as emergency team. We have about 90 people that have now come in. These are child welfare staff from across programs. They are working in pairs in Baton Rouge, supervised by child abuse investigator supervisors. They were called in to work a specific time frame of 7 days, working 12-hour shifts. This is what we do when we go into shelter duty. We call people in, they're in they're in increments of whatever time, but they work 12-hour shifts. And so this is familiar language to our staff to be called up this way, and that's what we did last week. When that 7 days is over, we'll roll in another team. We're constantly assessing how many cases are they getting through, how many cases are left, what is the need. We're assessing the need, and then we're making the decisions about what we need to do next. There is no surprise that there is a staffing crisis in Baton Rouge. We have spoken to you about that multiple times, and you have covered it. You have all covered it well. Right now, we do not have enough staff to adequately address the crisis that we are in with the number of cases that are coming in and the number of staff that we have to respond to that. There are 411 vacancies in this department today. 173 of those are in child welfare. We've been holding hiring fairs across the state. Many of you have reported on that. And those are going really well. We're onboarding a lot of people. It takes time from the moment we offer somebody a job until the time that they can carry a caseload. Excuse me. It takes about 6 months for a worker to be fully ready to carry a caseload because there's a lot of training and a lot of learning that has to go on about the agency. Even doing our very best every day at all times, we can not stop child abuse cases. Those cases are going to happen. We live in the world where people are harming children. The cases are mounting and our staff is low, so it's a crisis of both the number of cases and the number of people we have to respond. I have been doing this for a very long time. I have never seen this number of fatalities in a single year in my career. We already have 61 reported fatalities in this year through the end of October. That is up 13% from last year. The number of fentanyl cases that we are having are insurmountable. They're bleeding into our caseload. We have a fentanyl crisis in this city and in this state, and children are getting their hands on drugs that are killing them. The Sunday's Advocate editorial said that this is the impact of the pandemic's disruption of society. And I believe that that is exactly what we are seeing at DCFS. At the time when we are being called to answer more questions, we have fewer people to answer them, to answer more cases about children. We simply don't have enough human beings. And that is what we want to help you understand today. Dr. Hodnett is going to talk to you about the data in Baton Rouge. We have some data sheets that we will give you with those statistics on it, so you will have it to hand. And then after Dr. Hodnett, Evelyn Jenkins will speak, and then I'll come back up and we'll take questions.
Good morning. I'm Rhenda Hodnett, Assistant Secretary for Child Welfare. I want to give you all some details about the numbers in Baton Rouge specifically and what we're seeing there. So in the past 6 months in the Baton Rouge region, we've investigated 1,326 cases. That's a 32% increase from the same time period last year. So 2021, 6 months, comparing the same 6 months in 2022, and we see a 32% increase in the number of investigations we're having to take on. If we just look at the month of September as a comparison, it's a 63% increase in the number of cases. Let's look at some of the details from October. There were 259 new cases that had to be investigated in the month of October. We assign a recommended response priority to every case. Of those 259 cases, 100 of them had a recommended response priority of priority 1, which is 24 hours. Another 100 had a recommended priority response of priority 2, which is 48 hours. The remainder were a priority 3 or 4, which is 3 days or 5 days. Most of those cases we've had to ask Livingston Parish to pick up for us. We're carrying some of them, but Livingston is picking up some of those that have a little bit longer response priority on. We currently have nine permanently assigned investigators in the Baton Rouge region who could take cases. If they were all seasoned investigators and could all take full caseloads, the recommended number of cases they would be handling would equal them being able to cover 90 cases. We recommend 10 new cases per month. That would be 90 cases that they could cover. So that means that we have 169 that have to be picked up by someone else. And so that is why we are bringing in supplemental staff. from around the state. It's why we have supervisors and managers also carrying cases right now. It's why we've pulled every retired person that we can back into the department to help, and there are many who have come back. We're having hiring fairs. We actually hired a professional recruiter to see if is there anything we're missing that a professional recruiter might be able to tap into, and we've not found that yet. We're doing everything we can to respond as timely as we possibly can. We've hired several new professionals. We have 2 that start today, 11 that will begin training next week, and then 2 more coming on at the end of the month. So there is some hope about us being able to hire more people. If we were fully staffed, we would need to have about 25 to 30 investigators to cover the Baton Rouge region. Unfortunately, we lost 13 investigators in the last 3 months. So it is a constant effort to hire new people and to make sure that we're getting the right people in the door. This work is clearly not for everyone. It is a hard job. We have a lot of very dedicated staff out there who have been doing this work a long time. We need to find more of those people who are willing to go out there and do the hard work on the ground every day. So another thing that we're doing, in addition to bringing on our own staff, our own social work staff, we're hiring nurses from around the state. So we've brought in numerous nurses to help support our staff, particularly assessing substance-exposed newborns. We're bringing on contract staff. So we're working with staffing agencies to see if we can bring on additional staff to cover the whole 24-hour period. So a second shift and a third shift, also nights and weekends. We know that we have got to be able to give our staff some break. The same people who cover the day shift can't all be responsible for the same coverage of nights and weekends. So let's talk specifically about substance-exposed newborns. I would like to give you those numbers because it is very disheartening to see that since we have been tracking substance-exposed newborns in 2007, that number has continued to go up in this state year after year after year. There was a very slight dip during 1 year of the pandemic. Other than that, it's been an upward trajectory. In Baton Rouge, in the last federal fiscal year, we investigated 448 cases of substance-exposed newborns in Baton Rouge region. Continues to grow. What's more, during the month of October, as a result of all the investigations I told you about, 30 children had to be removed for their safety. 30 children in the Baton Rouge region just in the month of October. It's an average of 1 a day coming into care in Baton Rouge. Removals take a significant amount of time. You're talking about investigators having to go to court, working generally with medical and law enforcement very closely, preparing all the paperwork for the district attorney. So it's a tremendous amount of time and effort that goes into a removal, and there were 30 last month. I'd like to just give you the full numbers on our foster care program. So today we have 455 foster children in the Baton Rouge region. That's a 66% increase from 2020. I'm going to call up Evelyn Jenkins now, the Senior Deputy Assistant Secretary, to talk to you all about some of the things that we're doing in Baton Rouge specifically on a day-to-day basis to tackle some of these challenges. Thank you.
Good morning. I am Evelyn Jenkins, the Senior Deputy Assistant Secretary for the Child Welfare Division. As has already been established, Baton Rouge region has a shortage in staff. And so to address that shortage, we've had innovative tactics that have occurred, such as bringing in the strike team that you've heard about, as well as this rapid response team that's here now. And by the way, I would like to publicly thank the regional leadership in the child welfare divisions around the state for being active in demonstrating teamwork and being flexible with their staff. We are one DCFS, one child welfare division, and so when there's a need in one place, they have stepped up and helped us to address that need. In terms of hiring, we have had some hiring fairs that have occurred. One that has occurred here in Baton Rouge, and out of that we did get some potential staff, and Dr. Hodnett mentioned that earlier. Also, we have higher turnover in the Baton Rouge area as well as the New Orleans regions because of the opportunities that people have in these areas. There are numerous social service as well as government agencies that are greater in these areas than in other areas around the state. And so that contributes to people moving and leaving the agency and higher turnover in these particular regions. So we just have to try to address that with innovative techniques that we can think about. Also, as it relates specifically to Baton Rouge region and some of the things that are happening there, to try to work with the number of staff that we have, knowing that everyone cannot work carry out the responsibilities that they have according to their job titles. We have put in place morning huddles, and those morning huddles allow those persons that are providing supervision to have contact with the staff that actually are going out and doing the investigations, to touch bases to make sure that all the cases are being addressed and exactly what's happening on them. Additionally, we have a consultant that's providing assistance with the investigative plans, because a lot of the workers that we have, as has already been talked about, it takes about 6 months for a worker to really be trained and adequately prepared to do the work. So the consultant helped them to develop the investigative plan, assuring that it is in keeping with best practice principles. And that's just another way of assuring that children are being seen and that the proper work is being completed. Additionally, we have assigned a case assigner specifically to assign the reports as they come in. Everything is electronic, so they come into the what we call queues, and so this person will check the queue on a regular basis and assign the cases to the workers to go out and investigate. Recognizing the unique needs of the child welfare program, I was brought back to assist in helping with the leadership of the child welfare program. I worked for DCFS in the past and retired as the child welfare program director. And so now I'm working alongside Secretary Walters and Dr. Hodnett in this role that I'm in now. And what I came back because I saw that there was a need. I enjoy the work of child welfare. I enjoy helping the families and the children, and I want to contribute in any way that I can to the families and children of the state of Louisiana. We know that when we can have an impact on the lives of children and families, that truly we are impacting society in general, because the more we can help children to grow and to develop and become individuals that can contribute to society, then we are adding back to society. So I would like to end by encouraging anyone who wants to do meaningful work with children and families in the state of Louisiana, and you feel you have the passion, you have the dedication and commitment to do this hard work that we do, to please go to DCFSLA.gov, and you can make application for employment. Also, you can become a foster parent, because we do need foster parents. As children come into foster care, Dr. Hodnett gave the statistics on the number of children that have entered foster care. just this month here in East Baton Rouge Parish. And so it's happening all around the state, though. So if you have that, that drive that you want to help children and families, you can become a foster parent and care for children that we do have to remove from their homes. So I'm going to turn it back over now to Secretary Walters.
Thank you, Evelyn and Dr. Hodnett. We really hope that you will help us spread the word about the news for the hiring that we're doing, for the need for foster parents. You heard Dr. Hodnett say how many children came into custody just last month. We need foster parents desperately. And so again, you can go to dcfs.la.gov. That'll tell you all about our hiring fairs. It'll tell you about how to be a foster parent or any other information. So we will stop now and take questions.
Secretary Walters, President Oppenheimer with WDRC. State Representative Jason Hughes has been very critical of your agency. On Friday, after this other child died, Jerome Hall, he says, with each passing day, my opinion on the call for Secretary Walters' resignation is being confirmed. She's proven to me, she has proven to the public that she's incapable of leading this agency, and with all due respect, she's proven to be incompetent. How do you respond to him?
I respond that I serve at the pleasure of the governor. And as long as the governor and I are in lockstep about this, I will be right here.
So you have no plans to resign?
No, I don't.
Okay, Scotty?
Secretary Walters, members of the community are disgusted with these recent deaths. We have a child die, they see this familiar pattern. We come out, we apologize, we talk about numbers, we talk about caseloads, but what are the consequences? Has anybody been fired, or will anybody be fired because of what's happened?
I'm not going to get into details of personnel actions. After the first incident back in August, there were some personnel changes that were made then. We are still in a very open investigation right now, and I have no comment on any personnel actions right now.
Can you tell us why it took 5 days for your agency to release details about this child's death when he died on Halloween, and you guys released information an hour before the LSU-Alabama game?
Certainly I can. Our investigation does not follow your media cycle. I'm not going to come out and comment and say something quickly that is inaccurate or that I don't know to be true. We take a lot of time to go through all our records, to talk to all the people that are involved in a case before I'm going to make any statement. I know that's frustrating to you. I know you want us to come forward and say something very quickly. The law is very clear about how much I can say and when I can say it. And that law is to protect victims. This is about victims' rights, the confidentiality of the information that we hold. It is not gossip. It is not something to be taken lightly. I take it extremely seriously, and I'm not going to speak to you until I know that I have all the facts at my disposal that I can say when I can say them.
Secretary, back in August, you just made promises about policy changes that were being implemented. One of those specifically was talking about how quickly you all respond to cases in that nature. It seems like, though, this has happened again in terms of someone being sick and then something falling through the cracks. What can you say specifically about how people handle those cases that's being done to make sure this doesn't happen again?
Thank you, Scotty. As we have said over and over and over, staffing is tough. The worker that took this case, that got assigned this case, is actually a supervisor who had stepped back to be a frontline worker so that she could help with the caseload. We have managers that get the reports from the supervisor or worker, whichever level they are, because we have managers carrying cases, we have supervisors carrying cases, and so there's a chain of command that needs to be followed to make sure that the cases are input quickly. That specific worker worked all weekend and took in 3 more kids, 3 removals. You heard Dr. Hodnett talk about how hard and long removals take. By the time her information got entered, it just wasn't picked up.
But is there a fail-safe in place to make sure that?
There is now. That's what when Evelyn was talking about this case assigner, that will be one person who will do nothing but watch all of these cases as they come in to make sure that they are being assigned quickly and appropriately to the right level of response.
And that's someone that's already trained up to par and ready to go?
That is somebody that is here now that just started.
Secretary Walters, the fatality numbers that you gave us, are those statewide and are those validated or reported? Like at what point in the process are they?
Dr. Hodnett gave you statewide numbers, and I think we have all her data printed out for you.
And how much responsibility does DCFS bear in the deaths of those 61 children?
You know, every single child that comes to our caseload is precious to us. Every single family that we deal with is in crisis, or they would not be here. They don't come to us if their life is okay. Of course, we feel like we take responsibility for every family that we incur, whether they're in a disaster, in a storm, and we're giving them shelter, whether we're giving them food after their life has been wiped out by a flood, or whether they come in through child welfare. Every family we touch, we feel burdened and responsible for because we're here, because we feel called to this work. There is not a man or woman that works in DCFS that's here for a light, fluffy, easy job. These jobs are hard. They're demanding. The information we have is gut-wrenching and personal and hard. And so everybody that's here takes this seriously and personally.
How would you grade your agency's performance?
I'm sorry?
How would you grade your agency's performance? You have 2 deaths, very similar circumstances. You say that there have been changes that have been made. How do we know 4 months from now we're not going to be talking about another kid?
I'm not going to put a grade on this agency.
You talked about someone coming in specifically to monitor cases, make sure they were handled. Why did it take another child dying for that to be a priority?
I don't think it took a death for that to be a priority. I think we have been working what we presented to the legislature. The 7 strategies that we presented were the big picture things that we knew we had to do to stabilize the state as well as Baton Rouge. And in the plan were a lot of things that are just taking time to unfold, like the contracts, bringing in the contracted staff. It takes time to get all of that in place. It takes time to mobilize 90 people to come from the different parts of the regions to get here.
One of your workers spoke to us last week. She said that she felt like the situation was out of control, and while leadership means well, she's not necessarily confident that you all know exactly what to do next to fix things. What's your response to that?
I'm not going to speak to anonymous workers. If the worker wants to come and talk to me, my door is always open. I'd be happy to talk about that.
Okay. Well, I think that we've answered questions, unless anybody who hasn't asked a question. Ariel?
I mean, we've talked about finances here and there, and you've talked about it's not an issue about not having enough money, it's not having enough staffing, but we're also seeing this high turnover. A lot of it is because compensation for this very tough work isn't matched to what we can see at some other agencies similar to yours in other states. I mean, what are we doing to address staff and financing and pay levels?
Thank you. We have offered several different new pay mechanisms. Actually, in light of all of this, it has come to everybody's attention that our staff has not been adequately compensated. We've had civil service allows for some very specific, like special entrance rates or premium pay or overtime for special lengths of time. We have implemented everything. We've worked closely with civil service. We're meeting with them weekly to figure out what's the best mechanism, what can we do, how can we get our salaries up to a level that is comparable to the people that we compete against for these jobs. So we are working on it. I will never say that we have enough or that we have gotten to the pinnacle, but I think we're a lot better than we were even 3 months ago.
Okay, thank you very much.